My name is Joel Leyden. I'm the Executive Director of vaccineangel.com. Very happy and pleased to greet you in our Zoom event today, where we'll be speaking with the good doctor, Dr. Tony Alessi, or Anthony Alessi. How do you like to be addressed, doctor?
Either one. Anthony Alessi is fine.
Okay. And just in terms of a quick update, our group, vaccineangel.com, just like the virus, is surging. We have a great number of new members. I'd say in the last 2-3 days, we've had about 1,000 people joining us a day. We're just over 23,000 people from the Connecticut, New York area. We're associated with a group in Massachusetts, and we're doing our very, very best to make appointments and secure excess vaccine. But transcending all that, just also offering a warm environment, friendly environment where people can come in, say hi, how you doing, what's up. I'm having a problem getting an appointment, and the circumstances behind that. And also just offering some basic advice in terms of what's going on. What is COVID? Is COVID still perceived as the virus it was perceived as a year ago, or has data changed on it? From my research as a journalist, I could tell you that research has changed, not dramatically, but enough for me to be asking the good doctor a few questions in regards to those updates. And one such particular update is, it was first assumed that COVID-19 was transmitted by large droplets. If you were to sneeze, you were to cough, anything that would basically force, fluid from your body out, what's known as a large droplet. And because of gravity, it wouldn't really travel more than 6 feet. And that's the reason why we had such a CDC guidance saying, please maintain 6 feet social distancing. Although I like to say physical distancing because we could still socialize. Today, we understand that it's not just the large droplets, but we also have the small droplets that can travel up to 30 feet, that linger in the air for minutes, if not hours. And so I'd like to discuss this with the doctor in terms of, is this true? I mean, can he verify that COVID-19 is being transmitted, not just from person to person, but it could linger around in an indoor environment for a long period of time? Doctor?
Well, you raise a couple of interesting points in terms of the size of the droplets, the distance they travel, how long it lasts. We're all good questions, Joel, but the real answer to that is that there's a solution. If you wear a mask, the droplet can't travel, okay? So the solution is so simple and yet so readily ignored. So what we do know is that in recent data from the Mayo Clinic, 2 people adequately masked. Now, sometimes that means a double mask. And the test I use for people is take your mask, shine the light through it, a flashlight through it from your phone. If the light gets through, it's not sufficient. You need to double mask or use a surgical mask, such as the ones we issue when people come in the hospital. So if 2 people were adequately masked, they could be as close as 1 foot apart and not transmit the virus any more than if they were 6 feet apart. So that's the important factor here.
Does it make a difference what kind of mask you're wearing?
It does. You have to wear an adequate mask, an appropriate mask.
And what would that be?
As I mentioned, if you shine a light through it and the light goes through, it's not adequate. Then you need to double mask. So what they have done is, everybody's in a hurry to get venues open and arenas and stadiums. And I think we're moving toward that. But again, people have to be adequately masked. So what they're doing is building the price of the mask and the price of a screening test into the price of a ticket. And I think that that's going to be the new normal for a while.
Okay, one of the things that vaccineangel.com advocated about 3 weeks ago in a petition to the governor of Connecticut was to please maintain the 50% capacity limits in restaurants. Because he raised the capacity limit to 100%. Now, some people say, well, that doesn't really make a difference. No, that makes a very big difference, because only in restaurants and bars that serve food, you take your mask off. If you're going to be visiting a shopping mall or store, you're going to be inside an office, you'd be wearing your mask on all the time. There'd be no reason for you to take your mask off. But if you visit a restaurant, you can't eat a hamburger or have a drink wearing a mask.
Correct.
So something doesn't quite make sense with that, especially given the fact that on Twitter, COVID-19 is airborne, is now trending, as opposed to that it's only 6 feet. No, it's more like 16 to 30 feet and just hangs out in the air. So if you take your mask down in a restaurant, you could be, from what I understand, easily infecting the people at the next table, and maybe even 3-4 tables from there, especially if there's inadequate ventilation. The Hartford Courant came out with an editorial this Sunday stating the exact same thing. Why? Why is capacity at indoor restaurants, outdoors fine, indoor restaurants at 100%? We believe it's a mistake, said the Hartford Courant. What does Dr. Alessi say?
Well, it's a mistake from the standpoint that, we're seeing numbers start going up here. And we haven't reached an adequate level of vaccination. Okay. So we've done a great job with the people over 65. But to be honest with you, that's not the population we're concerned with in these bars. So, perfect example. At UConn and stores, we now have 5 different dormitories under quarantine. Why? They went to a bar. Okay. That's the population that's not yet vaccinated. So I think it's a mistake to open the bars and restaurants this soon. Okay. But by the same token, I think that we could get there. We're very close to that, because more and more young people, and I find young people to be much more receptive to being vaccinated than some people, than some folks. So from that standpoint, I think we could get there. But obviously, if we were there, if we had made our goal, we wouldn't have, 5 dormitories closed at the University of Connecticut. So
when you say to shut, they shouldn't be open, are you saying they shouldn't be open, period, or they should be open at a reduced capacity?
They should be open at a reduced capacity. I mean, I think that's what's worked for us. Okay, it was working. But when you get rid of the capacity numbers, young people just pack the darn bars, and that's where we're running into trouble. And once again, it has affected the education of our citizens. So I think the proof is there for the governor to see that this was a mistake.
Now, also, it's not just a matter of the physical logistics that the tables might be 6 feet apart, that people would be wearing a mask in a restaurant. I have to ask the governor personally, how do you wear a mask and eat and drink at the same time? I'm not quite sure about that one yet. But the thing that I have observed, because I have been in 2 or 3 bar restaurants in the last few days, no one is wearing a mask. And no one is even 6 feet apart. The tables could be 2 feet apart from each other. And I wouldn't have been in any of these restaurant and or bar restaurants if I had not been fully vaccinated and went through the 2-week period of time to make sure that was fully in effect. Even though that does now raise another question. Doctor, have I put myself at risk?
So here's the thing. I heard this analogy today, and I think it's a really good one. And that is, say you're wearing a fireproof suit, right? Fireproof suits are not 100% effective, right? You're about 95% effective. So if you're wearing a fireproof suit, that doesn't mean you should go look for a fire so you could rush into it, right? And I thought the analogy was great. It's the same with the vaccine. The vaccine has given us 95% that we're not going to get it, 100% we're not going to go in a hospital, but why go looking for trouble? Why go into a bar where you may still get it and become ill from it? So I think it's a mistake. I think whether you're vaccinated or not, you're taking an unnecessary risk.
How much of a risk have I taken?
More than you should. I mean, you've got 5% chance that you can get it, and now we're dealing with variants, right? So we're in a race against. So rather than talk about what we should and shouldn't do, let's focus on what we really should be doing, and that's vaccinating as much as we can, as fast as we can, because we are in a race against the variants right now. And you could see that in areas where they've had effective vaccination rates, they're not seeing this rise in numbers. Our numbers are going up. That's evident now.
The numbers in Connecticut just came out.
That's what we need to focus on.
The numbers here in Connecticut have just come out, and we are in a surge. I believe it's anything which is over 3%. Am I correct? Which is troublesome, worrisome. The number of hospitalizations has gone up, and the number of tests coming out positive have come out. And these numbers come out every day about 4 o'clock. And I would say against this backdrop, against this hard backdrop of a surge, we still have the Hartford Courant with its editorial standing strong on its 2 legs. And now we also have the governor's advisory committee, 3 different healthcare providers coming out and saying, no, the governor's not making any mistakes here. What do you say to these healthcare providers?
Well, I'd like to have that conversation with Dr. Coe and Dr. Giffords. I mean, I think, that I would have to have them really tell me that they don't think that this is excess risk, because I think it's obvious that it is. And once again, it's one of those situations where why should you rush into a fire just because you have this suit on and you've got a percentage? Those are the same types of decisions they're making. Why take this excessive risk when you don't have to right now? You could wait a month and let us get out in front of this with more vaccine, because we have vaccine coming. You folks have been able to get appointments for a lot of people, and there are people willing to take the vaccine. So I think that's a real issue right now.
I think people should know what Dr. Alessi does every Saturday morning and every Saturday afternoon. Can you enlighten us?
Well, on Saturday mornings, I have a radio show called Healthy Rounds on WTIC, and typically on Saturday afternoons, I'm vaccinating people at Dunkin' Donuts Park, where this Saturday we have, I believe it's 800 appointments scheduled just in that day. Now, soon that's going to all change because the baseball season, the AA baseball season is beginning. So I think we're going to be out of there soon. So, but I know they opened up a new site at ESPN today, and that should help a lot.
The information I'm seeing in regard to vaccination and vaccines is good information. From what we could tell from the 23,000 people we have in vaccineangel.com, it appears as though the vaccination process is starting to run a little smoother, that a lot of the websites are working better, because at first they were all overwhelmed, whether it be a federal or a state website or the individual healthcare providers such as CVS or Walgreens or Walmart. They were all having problems. And for the most part, all you would see is all appointments booked. Nothing available right now, which would create a tremendous amount of frustration. What do you say to these people who are trying to get vaccinated and get that message in their face? That is no appointments available.
Keep trying. It seems that it's really the persistence of trying that gets you an appointment, or get in touch with Vaccine Angel. My daughters have both been finding appointments for many people. I was able to set some up myself. So, if you persist, they're out there.
We go by the slogan of persistence, patience, politeness. And I thoroughly agree that persistence, if you're not persistent, then you just have to wait a lot longer in terms of getting that jab in your arm. We have, as of today, over 24 moderators on standby 24 hours a day, 7 days a week. As people come into the room saying, hey, I'm located in this area. Are you able to find me this vaccine or that vaccine? That leads me into the next question, this vaccine or that vaccine. Is there a difference in vaccines?
No, any vaccine. Their question should be, can you find me any vaccine?
But some people say, well, isn't this better than that? Or
No, they're all 100% effective at keeping you alive. And that's the fact that we need to be concerned with.
so if you're offered a vaccine, don't hesitate, don't delay, just go for it and take it. Stay alive, right?
Absolutely. Absolutely.
I know you've had a very busy day today. So let me ask you one last question. That is,
Sure.
what is your basic general advice as of April 5th in regards to what we can do beyond getting vaccinated to keep ourselves safer?
Well, I think, as I've explained in the past, it's a question of offense and defense, right? It's like any other game. Your offensive game is the vaccine. Your defensive game is masking, washing hands, social distancing. So you have to play both offense and defense if you're going to get ahead. So once again, as part of your defense, you're not putting yourself in a situation where you might get infected, whether that be going to a religious service where they're not socially distanced, where people are taking their masks off. If you're going to a bar or a restaurant where people are going to be not wearing masks, unless it is a life and death situation that you get to that bar, then you shouldn't be going, because again, that's part of your defense, and your offense is obviously getting vaccinated.
So let me try to understand you again. You had said they being the restaurants should not be open. And I believe that your response was no, their capacity should be reduced. Am I
Correct.
correct?
Correct.
Okay,
But as individuals, right? As individuals, unless we really need to go to that bar or restaurant, okay, there's this overwhelming desire that you have to be there. You should avoid it. It's not just to say, hey, I'm vaccinated, let me go try this out. Right? So everybody has to make their own decisions and use that offense and defense so that they can each stay alive.
so when do you believe it would be safe to go to a restaurant and or bar?
I think that we have to get a significant number of people vaccinated, and that number is variable. And let me explain. But by variable, I mean you will know when you have hit an adequate number, because your other numbers, your statistics of positivity, will start to go down and stay down. You won't have these surges. So, for example, if you look at the older population right now, right, the seniors, where we've had 70 to 75% of that group vaccinated, that's not where we're seeing the positivity. We're seeing it in younger people who have not been vaccinated. So when we will know when we reach that number, when we see our numbers coming down and staying down for a period of time. That's when you start opening more things up. And the last thing to open are the bars, right? All the epidemiologists told us right in the beginning, close the bars, open the schools. What
Well,
do we do? We open the bars, and we're just barely starting to open schools. So again, we didn't take advice.
I have a good number of people that like to uh, state that bars are closed in Connecticut. And I like to remind them that most bars are restaurants. And if the bar is serving food, they're open. So the bars are not closed. Restaurants are not closed. Along these lines, we have a large group of people, well, not large, maybe a third or 25% of the population, which is vaccine hesitant. How do we reach them?
Well, you just keep talking to them. I mean, I talk to at least one person a day who's vaccine hesitant, and you try to give them good information and make it clear to them the importance of being vaccinated. There's only so much you can do, and you have to know the difference between vaccine hesitant and vaccine defiant. There are some people who are absolutely defiant, and those are the people we're not going to reach. So you have to keep providing good information.
The restaurant bar that I had visited on Saturday night, I asked a few of the people, I just was curious, did you get vaccinated? No, I don't need to. I already had COVID. I'm okay. I'm fine. What do you say to these people?
That's a mistake, because we're now dealing with the B.1.1.7 variant, and you're not necessarily protected with the immunity you got from getting the variant we've had previously. Whereas with the vaccine, currently you are protected against that variant. And that's the variant that we're most troubled with right now, the B.1.1.7. So those people are just sitting ducks, waiting to get picked off.
All right, another person has come back at that same restaurant bar saying to me, Joel, look at the death rate. Death rate's low. No one's dying from this thing.
That's crazy. Tell that to the 553,000 people who are dead and their families.
All right, my response was, let's transcend the death toll. Let's think about people who have suffered from COVID, which is in the millions, and the severe devastating damage that COVID has done to the lungs, to the heart, to the brain. He had no response with that. I said, all right, maybe the death rate is not so high, although I personally believe it's high, and as you stated, as you articulated, extremely high. But the impact, the long lasting, I think they're called the long haulers. Is that what you refer to them as?
Sure.
Long haulers will be suffering a lifetime in terms of having been hit by COVID, which just cripples your internal organs.
So I think, to be honest with you, even one more person dying while vaccine is available is a disgrace. That's basically it. No one should have to die now that the vaccine's available and we could get it out there.
Would you be for just closing all of the restaurants, all the indoor restaurants?
Gee, I don't know that I know enough about it to be honest with you, Joel. So I wouldn't venture that guess.
Have you been to any?
No.
Okay, I just want to repeat. This is a medical doctor, and I'm asking him again. Have you been to any indoor restaurants? I'm safer
in a hospital, for crying out loud. I only take risks that I have to. I have to go to work in a hospital, and that's where I go. No, not going to a restaurant, Joel.
I want to see Dr. Alessi again soon. Doc, can you please give us the details again on your activities on a Saturday morning?
Radio show is Healthy Rounds on WTIC 1080 AM here in Hartford from 11 to noon.
Looking forward to hearing you.
All right.
Looking forward to hearing you this coming Saturday. Everyone, thank you for being here. VaccineAngel.com. Wear a mask.